I'm Col Todd Fredericks, DO. I'm a physician and the state surgeon of the West Virginia National Guard. I'm also a psychiatric hospitalist, and in that role I take care of the medical needs, the diabetes care, the high blood pressure care, the musculoskeletal injuries of a patient population that mostly lives inside of a locked psychiatric hospital. And so today I want to talk to you about those types of facilities. The locked facilities, the long-term facilities, the nursing homes, the skilled nursing facilities, the psychiatric hospitals, the jails, the prisons, places where people generally stay for a very long time. In the last 35 days, the West Virginia Guard has been working actively with the state of West Virginia to support it in its fight against COVID-19. And so the concern is what do we do with these places that have populations of people, patients, that stay for a very long time? We're not particularly concerned about the patients giving us disease. We're concerned about staff members, maintenance people, administrators coming in and out of the facility giving patients disease. And for that reason, it's really important we talk about how do we prevent that from happening. For those of you who follow the news, you're aware that we've had nursing facilities in the state of West Virginia that have had cases of SARS-CoV-2, COVID-19, and that those cases were generally thought to be brought in by staff members. This is a disease that doesn't easily let people know that they're carrying it. And because of that, it's really important that these facilities emphasize hygiene, emphasize the use of face protection eye shields, reverse isolation mask or RIM, the simple cloth masks that are used by staff members when dealing with the patients that live in these facilities to prevent the odd sneeze or cough from actually exposing patients to these problems. The other thing we're learning about SARS-CoV-2 is that it can be transmitted by footwear. For about the last century or so, people in operating rooms have known that footwear can transmit infectious disease. That's why for the last 50 to 100 years, operating room personnel have always worn shoes that stayed in the operating room and then changed into their street shoes when they left. In that case, it's a concern about bringing something home that was brought from the hospital. In the case of the patient populations I'm talking about with you today, it's bringing something from the outside in. And for that reason, I think it's very important that we start educating those staffs that they have a pair of shoes that's used in the community and a pair of shoes that's used at work. Preferably those shoes at work would be clogs. And the reason why is because clogs don't have laces, which can easily get contaminated and harbor things like droplets. They can also be easily cleaned. They can also be comfortably slipped on and slipped off. Shoe covers, which many people think are an easy solution, aren't as easy as you might think. As a person who has feet that are a little different than the average size, I've found it always very difficult to use shoe covers. And the reason why is because they're typically one size and difficult to get on and off my shoes. In fact, oftentimes I run a greater risk of contaminating myself by just putting the shoe covers on and off of my shoes that I've worn. So preferably the shoes are slip-on and easy to just leave there. The last thing I want to talk about is habits. Human beings are incredibly adaptive. We've been designed to adapt to circumstances. There are human beings, the Laplanders of northern Norway, who live in the Arctic, and there are human beings who live on the equator in Ecuador. And they all thrive, and they raise families, and they have lives, and they grow food, and they have economies. So human beings are designed to live in a lot of different circumstances. But what human beings aren't real good at is rapidly adjusting to change. Things that have always worked in the past are typically thought to be the means to success in the future. And so for this, I appeal to administrators. Fighting SARS-CoV-2 in the second and third and fourth wave is going to be different than this first round. In the first round, we have not had as much PPE as we'd like. In the first round, we've not had as much cleaning material as we'd like. But in the second round, as the supply system catches up, at that point, we won't have much of an excuse for not doing those things. But again, habits are hard to create. In fact, there's even a saying, it takes 30 days to create a habit. And for this reason, doing in-services with your personnel long before SARS-CoV Wave 2 starts, which roughly approximates influenza season, means that by August and September, Administrators, nursing supervisors, doctors who are advocates for the medical personnel in their facilities need to start encouraging the regular in-servicing of personnel to understand that they have to increase their sanitation efforts. They have to increase their cleaning. They have to start being more conscious of face shield use and reverse isolation masks in units. They have to start even thinking about, are my shoes properly equipped and clean so that I can leave a pair of shoes in the hospital? I need to start thinking about that. SARS-CoV-2 is an interesting disease. It's going to come in those waves, and there'll be times when we can take off our masks and we can hug our grandmas and we can do the things that we've wanted to do for a month now, but we've been avoiding to keep people from getting sick. But that will happen again. And the time to prepare for that is not when it starts, it's a month before it starts. The other thing I'd say is that within each of your communities, and especially in West Virginia, there are resources for administrators who don't know quite how to do these in-servicing and PPE protection. In the West Virginia Guard, our SURF team has been aggressive at reaching out to merchants and other people to try to train them in the best ways and practices for keeping their businesses and their facilities operating in a way that keeps them safe while allows them to go through the process of a COVID-19 or a COVID-20 wave and come out on the other end successful. All it takes is one individual not doing the proper hygiene, not doing the proper mask wear to infect another individual. And in the case of a nursing home, that could be devastating. This is a hard time to live through. It's a lot of education, but we've been through it before. In 1918, we went through the flu pandemic of 1918, and everybody now knows pretty much that St. Louis approached it one way and Philadelphia approached it another. But at the other end, Americans continue with their lives, learned to adapt and to grow, and took the challenge on. Hand hygiene has always been important, and one of the silver linings in all of this that I've thought of as a strategic medical planner is that we should see our rates of influenza drop and our rates of other infectious disease drop as people become habitualized. They create the habit of always washing their hands. As a person who washes his hands compulsively, that's exciting to me, because what is a life worth? What is it worth for your grandma not to get influenza? Is it worth it to wash your hands for 20 seconds? I think so. And I think we can all learn it. And if we're sensitive to the 30 days to create a habit and we start planning early, the next wave of SARS-CoV-2 will be an inconvenience and not a crisis. So with that, I leave you. I wish you a great day. And if you have any questions or concerns, please reach out to your local community resources, and certainly reach out to your Department of Health and Human Resources, your county health departments, and even your National Guard. There's probably a resource there that can help you tackle the problem you have in your unique situation.